Hello everyone, this is Project Group 2, and our clinic is called Detroit Community Health Haven. My name is Sarah Freyer, and I'll be talking about phases 1, 5, and 7 today. So to start off, phase 1, defining our organization, our community health clinic is located in the metro area of Detroit, Michigan, and we are considered a medically underserved area, so there's a great need for community clinics. We are a federally qualified health center, which means that we receive funding from the U.S. Department of Health and Human Services, and we also receive reimbursements from Medicare, Medicaid, we take patients' private insurance, and we utilize local grants. Our facility specializes in primary and secondary care, substance abuse support, HIV testing, as well as community education sessions. Some of the services we offer include well child exams, so pediatric care, immunizations, OBGYN care, family planning, mental health evaluations. We have an urgent care, lab services, x-ray diagnostics, as well as ultrasound diagnostics, and we also have a pharmacy with affordable medications for our patients. So we are open Monday through Friday from 9 a.m. to 6 p.m. and Saturday 9 a.m. to 2 p.m. for urgent care visits. Our facility has a total of 15 patient exam rooms. We also have a diagnostic imaging room for x-ray equipment, an ultrasound room, a pharmacy, and a lab for diagnostics. Our employers include 2 primary care physicians, 2 family nurse practitioners, an OBGYN, a pediatrician, as well as a psychologist, a pharmacist. We also have 10 nurses, an ultrasound technician, an x-ray technician. We have 2 medical assistants and 2 pharmacy techs, a mental health counselor, 2 front desk administrators, and lastly 2 custodians. We also offer our patients a flexible sliding fee scale payment system, which means that our services are very affordable for patients because the amount they're required to pay depends on the size of their household and their yearly household salary.
Hello everyone, my name is Olivia Barham and I am going to be presenting phase 2 and phase 8. So in phase 2, we really just focused on the internal analysis key resources and competencies. One of our biggest key resources within the Detroit Community Health Haven would be our highly experienced staff. They all at least have 5 years of experience before working at our clinic. They're passionate and they don't care about the economic status of the patients at all. We have an excellent reputation with our community, and in our community they all know that we're there to help them, and we have had good patient satisfaction surveys. They're satisfied with the care that we provide, and they always return back to our clinic. For the second part of phase 2, we focused on the strengths, weaknesses, opportunities, and threats of the Detroit Community Health Haven. A few of the strengths, as I previously mentioned, were the great staff, the positive patient feedback from all of the surveys we have conducted, obviously the comprehensive services such as the preventative care and the testing, the affordability of it since we are in a not so economically served area, and then the community involvement. As you'll get into throughout the presentation, you'll notice that we try to have some volunteers work, to keep obviously our payroll down, causes less financial issues, and it just overall helps out a little bit. Our opportunities would be to improve our online patient portal. Telehealth is getting very popular, which rolls into the next one, offering a telehealth system. While a lot of the people that come to our community center would not really be able to use this, it would be another option. And then to create more community programs. In a few years, we do have plans to open up fitness such as yoga, so that would be a great help. Weaknesses would be limited open hours, obviously. Long wait times would be one of the problems because, as we know, in an area like this, having so many people coming to us, it is hard to keep the wait times down. Free cash flow as well. We can only take so much money, and we only get so much money from charities and grants and stuff. And then the online patient portal, obviously with technology, you can't really control everything that's going on. A few of the threats would be competition from the other nonprofit clinics. This is one of the big problems, but as we can tell, we are more popular than those other clinics, and then patients leaving due to the frustrations with technology. Once again, it's not really our problem specifically because technology is unpredictable, but with a better training staff, we could definitely improve these problems.
Phase 3 Environmental Analysis. Let's talk a little bit about Detroit statistics. In 2023, Detroit's population was 633,218, 24.6% under the age of 18, and 14.4% 65 and older. The largest ethnic group in Detroit are blacks, 77.8%, whites, 12.2%, and 7.5% Hispanic and Latinos. The average household income is $54,000 with a poverty rate of 31.5%, which is higher than the state's average of 13.4%. This makes Detroit one of the poorest cities in the United States. 12% of residents are without health insurance, making most health services inaccessible to them. As a result, a large portion of the population suffers from preventable diseases such as diabetes, asthma, and cardiovascular disease. Detroit also has high levels of population, which ranks the top 5% in the country. This problem is affecting the health of residents, causing higher respiratory illness and contributing to climate change. December of 2022, more than 5% of people were living with the HIV virus, and 86 of those people were blacks, and 1/3 are black men.
Hello, my name is Marianne Haddad, and I'll be talking about Phase 4 and later on Phase 9. So Phase 4 focuses on defining our customer and market segments. Our primary clientele includes individuals and families in Detroit's underserved communities and neighborhoods. They are facing socioeconomic challenges like poverty, inadequate insurance coverage, and high rates of chronic conditions and illnesses. Economic factors significantly impact healthcare needs, with 31.5% of Detroit's population living under the poverty line. Affordability and access are crucial. Most of our patients are uninsured or underinsured, making DCHH's sliding fee scale a vital component of our service model to help ensure accessible care. Patient preferences, behavioral and sociocultural patterns. Our patients prioritize accessible, affordable, and holistic care, often seeking services that combine multiple aspects of care into one visit. They tend to use healthcare services sporadically, driven by immediate needs, highlighting the importance of having flexible appointment options. Sociocultural factors such as sedentary lifestyles and varied educational levels also affect healthcare behaviors and literacy, making tailored educational outreach something that is necessary to provide.
Phase 5, assessing our competitors. We have 4 major competitors and they have the highest market shares. So that would be Detroit Community Health Connection, Covent Community Care, Advantage Health Centers, and Huda Clinics. So Huda Clinics offers free dental, mental health, vision, and women's health services. They rely on donations from the public, and they also rely on volunteers to work at their clinic, which allows them to offer a lot of free services for patients. They serve an estimated 5,000 patients in Detroit. Advantage Health Center, they offer behavioral, medical, dental, and overall comprehensive care. They serve 15,000 patients, and they also offer a sliding scale fee payment system, as well as taking patients' insurance. And they focus on providing care for patients who are uninsured, and they focus on a lot of the social determinants of health in the community. Covent Community Care, it's a faith-based center, and they focus on more spiritual and holistic aspects of health. They are also a federally funded healthcare center. They offer a sliding scale fee payment system, and they treat 20,000 patients in the community. They also specialize in HIV and AIDS education and treatment, and they're one of the 2 clinics that have multiple locations throughout Detroit. Finally, our biggest competitor is Detroit Community Health Connection. They serve 35,000 patients per year, and they have the most comprehensive range of services, which is why they have a high market share. They really focus on culturally competent care, and they have an excellent reputation in the community because of that. They also offer the most satellite locations with 7 clinics throughout Detroit.
Phase 6, Mission, Vision, and Values. Mission. We are committed to improving the health of patients and increasing accessibility to healthcare regardless of insurance and income status. We provide high quality, comprehensive, and compassionate care. We empower individuals as we are dedicated to increasing education regardless of substance abuse and HIV treatment. Vision. We aspire to be premier provider of exceptional care. We strive to become the most trusted and affordable clinic in Detroit where every person has access to health care. We will improve and transform the lives of people we serve by increasing accessibility and expanding our services to promote physical, emotional, and spiritual health. Values: compassion, integrity, quality and professionalism, safety, cultural competence, innovation, creativity, and community engagement.
Phase 7 are strategic initiatives. So we ultimately came up with 3 objectives, and we hope to increase Detroit patients' accessibility to our services as well as increase the patients we serve. And that will ultimately make us more competitive in the market and give us that sustainable competitive advantage in the future. So the first initiative we came up with was expanding our community clinic to 2 new locations in Detroit in the next 5 years. So we'll open 2 new clinics, and that's an example of concentrated horizontal expansion because these new clinics are going to offer the same services, many of the same physicians, and similar patients just in different geographical areas throughout Detroit, which will increase the patients we serve and give more opportunities for our patients to go to other clinics of ours. Our next initiative would be to create a telehealth system in the next 3 years. So this will allow patients to receive the same quality medical advice and services that we offer just in the comfort of their own homes. And we believe that our behavioral and mental health services, such as like therapy sessions, can benefit from the service the most because it's more talking based. Another patient population that will benefit is the elderly population, and this is because they might not have the transportation to go to our clinic, so this will make it easier for them. And ultimately, all of our patients will be easily able to make appointments, virtual appointments in the patient portal once we get that process rolling. And our final strategic initiative is to create a community yoga, exercise, and meditation program in the next 3 years. So we will have staff that will coordinate these community sessions and go out into the community. And this approach is more comprehensive, it's preventative based because exercise prevents diseases, and that ties into our mission.
Hello everyone, it's Olivia Barham again, and I am now presenting Phase 8. So in Phase 8, we really just focused on implementing our plan. We are not sure exactly how long it would take, but from the calculations of our timeline, it should take around 22 weeks. One of the first steps would be consulting vendors to make sure, that all the steps are possible, and then would be consulting physicians. Obviously, staffing is one of the most important pieces. As I was mentioning, staffing is extremely important because, as we know, we would like to have a good rapport and satisfaction with our patients. So that would be one of the third and second steps combined of our timeline over those 22 weeks. Funding as well is one of the most important steps. This one is the one I would like to focus on the most because funding is probably the most important objectives of implementing. We would like to start charity events and taking advantages of other available resources such as donations, which would eventually arise out of those charity events. And then the more donations we got, the more charity events we could throw, so on and so forth, as well as using some state and federal funding if that's possible. With these fundings, we would be able to get an IT department allowing for the implementation of telehealth. And then for the final few steps of our timeline, it would be vendor proposal and presentation, which would be how we're using these resources and who we're using them with, analyzing the final options, selecting the systems and vendors all the way back from step 1, and then the last step would be final negotiations. And from here on out, our timeline and our plan should be pretty much implemented, obviously with just a few adjustments along the way.
Phase 9. Measuring and monitoring our plan for success. We will measure and monitor success using key performance indicators. These indicators include clinic operational readiness, funding acquisition success, and technology deployment. And these metrics, they will help guide our efforts and continue to ensure that we are meeting our objectives effectively. Regular progress reviews and feedback. Progress will be reviewed bi-weekly with detailed monthly reports to help monitor our clinic setup, staffing, and technology implementation. Feedback from the staff, from the patients, and the community will be collected to address issues as they pop up and to make any necessary improvements. Financial and technology monitoring. Financial performance will be closely monitored through tracking expenditures and through generating financial statements that will help ensure that our resources are always used efficiently. Technology will be evaluated through regular testing and through user feedback and to address any issues and always enhance the functionality. Community impact measurement. We will measure our impact on the community by tracking patient numbers, participation in the community programs, and the overall health outcomes. This will help us gauge the effectiveness of our clinics and of our programs and to continue to enhance the community health. And lastly, here are our references, and thank you for listening.